Well, hello everyone. It's been a while. I've actually sat down and recorded this video more than one time and just stopped. I guess it's kind of how bad it's been for me. It's been a long month and I'm getting pretty down about the whole thing. I'll probably have one more video after this. I've talked to a lot of you lately, some on the phone, some through email. I know one of the first people I talked to, Tara, she just had her trial and seemed to go pretty good. I wish you all the best. Mine is got to come out. I had, those of you know, I had the paddle leads put in this past March. They were sewn into place, and for some reason, the leads came out of place. Asked the surgeon why. He said he's never seen it before. I was supposed to have the stimulator out 2 weeks ago, and I didn't get cleared for surgery because of a high white count. Still trying to figure out what that was about. So as of right now, the removal is scheduled for November 1st, and this is it. 3 strikes and I'm out. I'm done with the stimulator. I want to clarify something. I want to make sure that, I'm sharing my experiences with you all, and I don't want this to be taken as medical advice on whether you should or should not get a stimulator. Everyone's different. My first stimulator worked out really well, and it's just kind of been a downhill after my initial fall with the first stimulator. Some advice: the stimulator is going to change your life. Got to remember that there's needles and leads and batteries and wires. In a couple of minutes here, I'm going to bring up some x-rays I don't think I've ever shown before. And you'll kind of see what's under there, and you're going to have to slow down. It's not, I kind of learned the hard way sometimes, because I hate being so stagnant that when I feel better I do too much. I blame that the second time around, but again, this isn't medical advice. I'm sharing with you all my experience, and ultimately, I don't want you to all take this as this coming from a medical professional. It's just someone who's gone through it. I was in so much pain yesterday at the sight of the leads, I had to go to the hospital. They gave me a cocktail Toradol, steroids, and Dilaudid. Felt a lot better, and now put me on the Medrol prednisone to help get me through until surgery, because the lead site was swollen and causing a lot of pain. I spent the majority of the week in bed. I actually tried to record this video on Tuesday and just couldn't even get through it. So what's next? I have no idea. Probably going to have to go back on oral meds for a while, and hopefully maybe give the pump a trial, the morphine pump. We'll see. If not, I'm off to a warmer climate that has legal marijuana. That's that. I'm going to go ahead and bring up my x-rays, and this will be a screen record video so you can kind of get an idea what this looks like. Those of you that are considering paddle leads, and so here we go. All right, we're going to bring up the first x-ray, and we'll go ahead and zoom in on that a little bit so you can get a better look at that. You're looking at a front view. That is the paddle lead that I was just circling around. That's at T9. Down there is the battery. It did get turned a little bit. It was straight up and down, not sideways like that when it was inserted. Okay, the next one, really can't seem to make anything out. The paddle leads are way up at the top, but they're barely visible, so we'll skip this one. I believe this is an identical copy of what we were just looking at on the first, but again, there's the paddle leads. Here's the side view. Once we zoom in on that a little bit and move up, there's some wires kind of on the back of the spine area, right in that area there. Okay, so now up. Okay, now we're looking at we'll move this over. This is the live video that was shot during the insertion surgery. You can see the pliers that are holding my skin apart, and the paddle leads are being stitched at T9. That's where they were supposed to stay and stay without moving, which obviously they did not, because we've talked about the stimulator needing to come out after the doctors have reviewed these x-rays. There's one more view. You can kind of see at the top the leads are kind of bending, turning in a different direction. So either the stitch had broken free. Back at the live x-ray during the surgery, and what are we doing here? Not much to see there. You can see the wires, and there's the paddles once again. And now we're back at the first video, or the first slide. That, folks, is what the paddle leads look like inside your body. Pardon me. That area where those leads are is very painful for about 2 weeks. I had a difficult time brushing my teeth and shaving. Anything that had to do with lifting my arms up to my head was pretty painful. So, all right, well, let's get back to the regular video, and we'll wrap this up. All right, so that's about it. I really don't have a whole lot else to say. I'm going to document the surgery on the way out, I guess. Not going to be any fancy videos. We'll do some phone videos and upload it and stuff. I think about those of you that I stay in touch with. I think about you all a lot, especially on my bad days. Because, no matter how bad you have it, there's always someone who's worse. And I know a lot of you out there are suffering, and it sucks. It affects your mood. It affects a lot of things. So disappointed with the turnout, but what are you gonna do? All right, Larry Fish signing off. I will post another video during the surgery, hopefully November 1st. Take care. Peace.